So this video, we are going to continue looking at causes of recurrent pregnancy loss. And this one will focus on thrombophilias or clotting disorders. When we look at clotting disorders, thrombophilias, they come in two forms. They are the acquired thrombophilias, so thrombophilias or clotting disorders that people are not born with, and they get these disorders later on in life, and we don't know what those triggers are, versus congenital or inherited thrombophilias. So these thrombophilias are conditions that people are born with. They're born with these clotting disorders and normally related to a gene change in the specific clotting factor. The main link with recurrent pregnancy loss and clotting disorders lies in the first group, so that is in the acquired thrombophilia group. People who acquire a clotting disorder later on in life tend to be more likely to have pregnancy losses, especially recurrent pregnancy losses, especially if they have something called antiphospholipid antibodies. This is part of a condition called antiphospholipid syndrome, and there are three antibodies that are present in this condition, and that may be linked to recurrent pregnancy loss. And there are some studies, albeit weaker ones, that show that if you treat with aspirin and a blood thinner called Clexane, which is a low molecular weight heparin, you may increase your chances of live birth. In regards to the congenital thrombophilias, the link between them and miscarriage, especially recurrent miscarriage or recurrent pregnancy loss, is much more tenuous. There are older studies that say that people who have these congenital thrombophilias, congenital clotting disorders, are more likely to have miscarriages. But when we have redesigned these studies to be more rigorous, to have more people in them, to be structured in a better way, more scientific, essentially, those links are not found. Furthermore, there are more recent studies that show that these thrombophilias, if you try and treat them with blood thinners, they don't improve the person's live birth rate. They don't drop the rate of miscarriage, and they only increase the risk of bleeding and bruising. Certainly, the congenital clotting disorders, things like protein C, protein S deficiencies, prothrombin deficiencies, factor V Leiden, antithrombin gene mutations, these are more likely to cause potentially growth issues. There are some studies that link them to slightly higher rates of stillbirth, but nothing to essentially recurrent pregnancy loss. The final thing I mention is, because this is so common, I see it a lot, is people doing genetic studies for MTHFR. MTHFR is a gene that codes for an enzyme that is part of folate metabolism, and there are some older studies that suggest that if you have a change in that gene, that you may be at risk of increased miscarriages. And as a result, people test for it, and they go on all sorts of supplements and blood thinners if they test positive for a change in that gene. The reality is, changes in the MTHFR gene is extremely common, so common that geneticists don't even call it a mutation anymore. They just call it a variant of what they see, a polymorphism. There's good studies that suggest that these changes are not linked to recurrent pregnancy loss. There are some older studies that link them to things like stillbirth, especially if another chemical called homocysteine is elevated. But certainly there is no link to recurrent pregnancy loss and changes in this MTHFR gene.